Welcome back to Functional Wellness with Dr. Allison, medicine for the body, heart, and soul. Today, we're talking about living well with POTS, the tools, tech, and truth that you need to know to help yourself be supported. So, POTS is a really complex issue. It's really frustrating, very debilitating to live with, and honestly, it's one of those conditions where the medical system just often fails people. So I want to give you what I've seen working with my patients over the years, share my own personal experience with it, and I'm genuinely interested in hearing what works for you too. So please reach out to me on Instagram or Facebook, leave a comment, let me know what's helped you manage your POTS because this is one of those conditions where we learn so much from each other's experiences. My personal story with POTS is relatively straightforward compared to what many of you are dealing with, but I think it's a good example of what maybe your average person experiencing this issue goes through. So, over the winter of 24-25, I got absolutely hammered by infections. First COVID, then the flu, and then about 5 times I had this going back and forth. And then, of course, my Epstein Barr decided to reactivate and come along for the ride. So, it was a perfect storm of viral chaos in my body. I had all the classic long hauler symptoms, including developing new asthma. I needed a new inhaler that I've never had in my life before, the crushing fatigue, where even thinking felt exhausting, muscle and joint pain, everything hurt. And then, of course, a symptom I wasn't expecting, which was POTS. Mine was obviously viral induced, and I had the classic presentation of my heart rate jumping from maybe 80 to 150 on a good day, beats per minute, just because maybe I rolled over in bed, or I just stood up, or did something that should not cause your heart rate to be at 150, like you're running a marathon or hitting the stairs. I couldn't walk more than a few feet before I just had to sit down, take a break. Getting from my bedroom to my kitchen just felt like climbing a mountain. I know you're familiar. Stairs were off the table for me as well. So it was incredibly taxing on my whole life. And even as a physician where I get to sit and be on video all day, I still was having a really hard time functioning. And I needed beta blockers just to be able to work and get through my basic daily life, which is not a bad thing. I'm really grateful for them. And as I started researching, I heard about nicotine patches helping with long haulers. And now I'd already done research on nicotine for a previous podcast. I'll link that in the show notes because I go into the physiology and the why behind nicotine's effect on the nervous system. But I want to be really clear. This is my personal story. This is not medical advice. I'm sharing what worked on myself as an informed physician who understood the risks and mechanisms. So I started using 7 milligram nicotine patches, and the first weekend was absolutely brutal. All of my symptoms flared like crazy. My heart rate was all over the place. My energy was gone. Everything felt worse. I literally just laid on the couch and played video games, trying to just not move. But after that first week, I started to see some progress, small improvements at first. Maybe I could walk to the kitchen without my heart feeling like it was going to explode. And after 5 weeks, my long hauler symptoms were pretty much resolved, including the POTS and the crazy heart rate. So I'm sharing this with you because I want you to understand that this is important. Nicotine is not a cure for POTS. What worked for me worked because I addressed my root cause, which was the viral issue triggering dysfunction in my nervous system. The nicotine helped modulate my immune response and supported all of the pathways that were disrupted by the viral infections that were causing my heart rate changes. So your root cause might be completely different, which is why we need to figure out what's driving your POTS specifically. So what is POTS? It's basically understanding the different types will help you advocate for yourself and make sense of what's happening in your body. POTS stands for Postural Orthostatic Tachycardia Syndrome. So let's break that down. Postural is related to your body position. Orthostatic is related to standing upright. Tachycardia means a fast heart rate, and you put it together and you get a syndrome where changing your posture or your position will change your blood pressure and your heart rate significantly, more so than what it should be normally. So what does this look like in real life? Your heart rate elevates significantly. We're talking about an increase of 30 beats per minute or more within a few seconds of standing, or a heart rate that goes above 120 beats per minute when you stand. This causes lightheadedness, dizziness, nausea, chest pain, palpitations, brain fog, fatigue, weakness, sometimes even fainting. But POTS isn't just about standing up. Many people also experience issues with fluorescent lightings, like you walk into a grocery store or Target and suddenly feel super dizzy, overstimulated, nauseous, like the lights are physically hurting you. You might have difficulty breathing, that sensation of air hunger where you can't quite catch your breath or get a deep breath in, even though your lungs are okay. And some people even lose consciousness during an episode, which is terrifying and even dangerous when we're out in public. So technically, the gold standard for diagnosing POTS is something called a tilt table test. This is where you lie flat on a special table that monitors your heart rate, your blood pressure, and sometimes other vital signs. And then they tilt the table upright to about 70 degrees and watch your body. Usually that's about 10 to 45 minutes, depending on what they're looking for, which is usually a significant heart rate increase, a drop in blood pressure, and other physiological changes. Some people will pass out, some people might not. Most people with actual POTS will feel pretty terrible, but nothing that they haven't been feeling before with standing up. And the current main medical treatment is beta blockers, which slow down your heart rate and can help manage your symptoms, but they're symptom management. They're not root cause treatment, but they are incredibly helpful and life-saving for a lot of people. I had to use them. They were so helpful. I'm so grateful for them. So we really do want to get to the root cause if we can with POTS. And it's never just one thing. There's actually a couple subtypes of POTS, and knowing which one you have is crucial for treatment. There's hypovolemic POTS, which is characterized by low blood volume. Your body literally doesn't have enough fluid circulating, so when you stand up, there's not enough blood getting to your brain and upper body. This type often responds well to increasing salt, fluid intake, compression garments, and addressing whatever is causing the low blood volume in the first place. Then we have neuropathic POTS, which is caused by a decrease in the sympathetic nervous system function, particularly in the legs. This is often associated with small fiber neuropathy, the tiny nerve fibers that help regulate blood vessel constriction. Those just aren't working properly. So when you stand up, the blood vessels in your legs don't constrict the way they should to push blood back up to your heart and your brain, so the blood starts pooling in your lower body. We can use different medications that are inhibitors to treat this and improve the nerve signaling, so that can be really helpful as well. And then we have hyperadrenergic. I can't even say it right now. Hyperadrenergic POTS. It is characterized by an overactive sympathetic nervous system. Your body is producing too much norepinephrine, one of your main stress hormones and neurotransmitters. Technically, this is defined as plasma norepinephrine levels greater than 600 picograms per milliliter. So we do have some testing for this, and you'll probably feel more wired, anxious, jittery, may have more pronounced symptoms with stress or certain foods. So this is the type that's most commonly treated with beta blockers because we're trying to calm down that sympathetic response. And then some people have a combination of these types, which makes treatment a little bit more complex, but not impossible either. So what happens usually when you suspect POTS? Honestly, I feel like the typical experience is not a very good one because I've heard the story over and over from my patients, and it's so frustrating and demoralizing. Now, usually first you're referred out to a cardiologist. And honestly, from what I've heard from my patients, you're going to wait a few months to even get in while you're suffering and trying to function despite feeling absolutely terrible. Then, when you do finally get your appointment and you go in hoping for help, hoping someone believes you and will figure out what's wrong. And then a few things happen. Either they don't believe you and they look at your EKG, or maybe they do an echo and they say everything looks normal on all these tests that they run, your blood work's fine, and they tell you that it's just anxiety. They might even suggest you see a therapist instead of treating this as a physical condition. And this is especially common for women. And there's a study coming out in April that's talking about how anxiety is a symptom of medical gaslighting, essentially. Now, if you're lucky, they do believe you. They recognize the pattern, and maybe they've seen POTS before, but you may be told that it's a nervous system disorder, that it's dysautonomia, and you need to see a dysautonomia specialist. except I don't think that a specialist actually exists. There may be a handful in the entire country who specialize in dysautonomia, and they're going to be weird people like me, like functional neurology. So maybe you're left with a diagnosis or prescription for beta blockers or increased salt intake, and these medications might help. They might not, but you're still suffering. So if this is you and you're unable to live the life the way that you want to, you can't exercise, you can't stand up, you can't do basic activities, you can't go shopping. It's a horrible process. So we're going to talk about what to do today, okay? So I promise we're going to get there. Now, there's some amazing cardiologists out there who really are trying to help and understand POTS, who will work with you to find solutions, but there aren't enough of them, and we really need to get you the tools to help you do this effectively. So, number one thing that can help is bringing data. If you have a wearable device like an Apple Watch, an Oura Ring, or a band, any fitness tracker that monitors your heart rate, screenshot, download, share those data, that heart rate spikes, bring it to your appointment, because sometimes seeing that objective data makes doctors take it more seriously. Maybe they'll order that tilt table test, maybe they'll try different medications, but at least you're giving them something concrete to work with. All right. Let's dive into some root causes because this is where functional medicine really shines. We're not just asking how do we manage these symptoms, we're asking why is this happening in the first place and what can we do to address the underlying dysfunction. So it definitely depends on what type of POTS that you have. So if you have hypovolemic POTS or low blood volume, you really need to look at hydration, salt intake, movement patterns, and your digestion as well, particularly your large intestine because it's absorbing water and minerals and it houses your microbiome. And if you're not holding on to hydration despite drinking plenty of water and electrolytes, this may be where one of your issues is. It could be bacterial overgrowth like SIBO, infections, inflammation, or motility problems that impact how your body absorbs and retains water. This tends to be pretty straightforward to work on once we identify what's going on. So make sure you can get a stool test and get some support there. With the other POTS, there are a couple potential root causes, and you might have one or you might have several of them. So first, we talk about dysautonomia. This is a dysfunction of your autonomic nervous system, which controls all the autonomic functions of your body, your heart rate, your blood pressure, your digestion, temperature regulation, everything you don't consciously need to think about. So we need to support and retrain the system. The second most common, I think, is viral infections, and this is what happened to me. Viruses like Epstein-Barr, COVID, the flu, others can disrupt your nervous system as well and then trigger those inflammatory responses that lead to POTS. And even after the infection clears, viral particles and inflammatory signals are going to persist and continue to block these pathways which your neurotransmitters work so you can actually start to manage your heart rate. But it can happen with any viral infection, not just COVID. The third one I'd like to talk about is mast cell activation syndrome, or MCAS. This is commonly associated with POTS, and they often co-trigger each other. I wouldn't say that MCAS causes POTS or vice versa, but they frequently occur together because both involve dysregulation of your nervous system and your immune system. So when your mast cells are overreactive, releasing histamine and other inflammatory mediators, this can absolutely affect your autonomic nervous system and contribute to those POTS symptoms. Fourth, connective tissue disorders like EDS. If your connective tissue is more lax or fragile, your blood vessels don't constrict and dilate as effectively, which can lead to blood pooling and POTS-like symptoms as well. Fifth, autoimmune conditions. We know that autoimmune antibodies can target components of the autonomic nervous system, leading to dysfunction. This has been documented in conditions like autoimmune autonomic ganglionopathy, but it also can be just very common autoimmunity. Six, we have nutritional deficiencies, specifically iron and magnesium and Bs, which are really important for red cell production and how we carry our oxygen. Seventh, deconditioning is commonly blamed, where you've been on bed rest for a while or you're just told you haven't been working out, so your cardiovascular system is not functioning. But I don't think that's as big of an issue for the most common person dealing with POTS. The key is figuring out which of these factors are at play for you specifically, because that determines what treatments will actually work. So let's talk about how we can support all of these things, your overall system, so you can function. And I want to say this again. If medication is helping you, that's wonderful. There's no reason to jump off of it and risk making things worse. You can work on your POTS and your health alongside these medications. This is not an either or situation. So let's walk through the functional medicine options kind of by category. So lighting and sensory support. This is my new intrigue. I'm really excited about looking into this research and sharing this with you because it can make a practical difference in daily life. So if you struggle with grocery shopping or going into fluorescent lit places, you're feeling dizzy, overstimulated, and just weird, I know I do. The good news there is that glass is specifically designed to help with this. You can look for FL-41 lens options. These are rose-tinted glasses that filter out the specific wavelengths of that fluorescent lightings that trigger symptoms. You can get them from Theraspecs, Axon Optics, or Zenni Optical, which has some great budget-friendly options. You can ask your optometrist as well what they would recommend. You can get these as regular glasses. You can get them as clip-ons that go over your existing glasses or fit over style. They can come as prescription or non-prescription, depending on what you need. And if the FL-41 isn't strong enough for your sensitivity, there's a brand called Avolux, AVULUX, that makes even stronger lessons for more severe light sensitivity as well. And if you're having like heavy screen time, consider getting a separate pair of like amber or orange tinted glasses that can help filter out blue light and support your nervous system's winding down in the evening. Okay, next let's talk about hydration support because this is crucial for all types of POTS, but there's a lot of weird information out there about it. So I typically recommend IV hydration because it can be such a big game changer. You can access urgent care centers. They will usually offer hydration support, infusion clinics, but those will require a prescription from your physician. And there's also new IV therapy spas or nurse practitioner offices that offer this service, which is great, but also can add up if insurance doesn't cover it. So this is really something important to talk about with your physicians. For daily hydration support, you want to drink electrolytes because you want to be able to increase that salt intake. You do need significantly more salt than the average person, probably around 6,000 to 10,000 milligrams of sodium per day. So make sure to talk about your doctor what's right for you, especially if you have any kidney issues or high blood pressure concerns, but we still need to make sure that you're hydrated. And this is where the large intestine comes in. Your colon's main job is to absorb water and minerals, and like I said, be home for your microbiome. If you're not retaining hydration despite drinking all this water, there may be some issues with your gut. We can do a comprehensive stool test to look for bacterial overgrowth, maybe parasites, inflammatory markers, but specific issues about overgrowth and what's going on with your gut. So we can use support like probiotics to support healthy bacterial balance, antimicrobial herbs to address any overgrowth, fibers or binders to support proper intestinal function and reduce that endotoxin load, and then enzymes to support your overall function. And there's a lot of personalized work to be done here, so I don't want to spend too much time on specifics because it really depends on what's going on in your gut. But I want to bring this to your awareness because it is often overlooked when we're talking about hydration and getting more into your body, and it's not just about electrolyte balance. Viral support is the next one. So if you have POTS, viral support is something that absolutely needs to be managed first. Like we talked about, nicotine patches, specifically the 7 milligram ones, to modulate that inflammatory response and support those pathways can be crucial and key. There is some emerging research on it, but working with either a knowledgeable practitioner and going slow if you're considering this approach. You don't need to upgrade the level or the dosage of the nicotine either. You can try supplements like monolaurin, enzymes like nattokinase, peptidase, and lumbrokinase. Those are from earthworms, which sounds very gross, but they are very effective at supporting viral reduction in the cells. And if you have autoimmunity, you want to avoid immune stimulators that push you towards either that Th1 or Th2 dominance. Everything that I mentioned there is immune neutral, meaning they support your body's natural process without pushing your immune system in one direction or another. And this is crucial because we don't want to accidentally trigger an autoimmune flare while treating your POTS and any viral issues as well. Now, you probably already grabbed your compression socks and your compression garments, which are so helpful because they prevent that blood pooling in your lower extremities when you stand. And there's a lot of options out there. My personal favorites are the toeless compression socks. They're just easier on your feet, I think. And I wore them during all of my hospital stays and my surgeries, and they're super comfortable, full coverage socks. You can wear your regular shoes or flip flops, very easy to deal with. If you want medical grade compression, typically 20 to 30 mmHg for POTS. That's the label that you want to look at. Higher compression can work, but it may be uncomfortable or affect your lymphatics, so start really low. Beyond socks, there's a couple other structured options like compression stockings that go up to your thighs or even waist high. There's abdominal binders for compression around your core. And there's also full compression garments, so like head to toe, shirts, bras, abdomen, legs, things like that. So it can help with pain management a little bit, as well as lymphatic flow. So see what works for you. So when it comes to wearables and tracking, this can be so important because these devices tell you everything about your heart rate variability, where your heart rate is starting to spike, when you need to rest, what activities are causing overexertion or overtraining. And yes, overtraining for someone with POTS can mean just folding the laundry. Maybe you need to do that sitting down rather than standing up and bending over the couch or the bed or picking things up. So Visible Brand is a patient's favorite of mine. It's an app paired with any wearable that helps you track your symptoms and learn your limits. But you can also use any watch or ring that you prefer, Apple, Oura, Whoop, Fitbit, whatever works for you to track your heart rate continuously. There is a new option called Lumia Health earrings, which are designed to track blood flow to your head by monitoring the perfusion in your earlobe. In theory, this would be valuable for POTS since blood flow to the brain is exactly where we're concerned about. However, I'm not really convinced that this is the best approach yet. They're pretty pricey, the accuracy isn't quite validated in the studies, and I question if the external ear is the best measurement site because we know that cold extremities, including ears and nose and fingers, can be influenced by food sensitivities, thyroid function, and other factors that can affect this. So I'd almost say wait on that technology till we have more data. Unless you have the budget and you're curious, I'd say go for it. Another favorite topic is iron and anemia because this is my go-to place to look when someone has POTS. Someone can have anemia without it affecting their CBC and still have POTS symptoms because we need our iron to transport our oxygen. So getting your iron panel checked, not just the hemoglobin and iron, but ferritin, serum iron, TIBC, transferrin. And for POTS patients, I like to see ferritin above 50, ideally closer to 80, even though the normal range can go much lower. We want to make sure those stores are there. And if you're low, you definitely need to supplement, but be careful with the constipation and stomach upset. So taking iron with vitamin C will enhance that absorption, trying different forms because some people will tolerate the biglycinate better than the sulfate, taking it on an empty stomach if you can tolerate, or food if you can't, and avoid taking it with coffee, tea, or calcium because that might inhibit some of your absorption as well. So let's dive into dysautonomia because we want to retrain and support your autonomic nervous system, and there's several approaches with this. Craniosacral therapy is another one of my favorite referrals out. It can be incredibly helpful. It's a gentle manual technique that works on the nervous system through light touch on the spine, the legs, and the head as well. You can see a massage therapist, a chiropractor, or physical therapist that's specialized in this, and it's great for nervous system rehab. A lot of people like the Safe and Sound protocol for vagal toning exercises or the salamander exercises developed by Dr. Stephen Porges based off of his polyvagal theory. Using eye movements, head movements, and specific physical positions like turning your head to the side can activate and strengthen that vagus pathway for your autonomic nervous system. There's quite a few YouTube videos out there demonstrating these, or you can work with a practitioner trained in this approach. Super easy to do and also very easy and effective. Now we can do breathing, specialized breathing, box breathing, extended exhale, extended inhale, all of these to work with the vagus nerve and shift your nervous system towards parasympathetic, so that rest and digest function. And of course, using biofeedback apps with all of this work will help train your system over time. Next, we want to look at vestibular rehab, which is physical therapy specifically designed to retrain your balance in your vestibular system. This is often disrupted in POTS, and it combines eye movements, head movements, and balance challenges to strengthen the connection between your inner ear, your vision, your brain, and your nervous system. I also give my patients my personalized